Welcome to introductory lesson about broken knees. In this lesson, we'll provide a brief overview of what happens when a knee is fractured and how it can be treated. The knee joint is one of the most complex and crucial joints in the human body. It consists of the femur, tibia, and the patella, all held together by ligaments and tendons. When a knee is broken, it means that one or more of these bones are fractured. This can occur due to various reasons, such as trauma from accidents, falls, or sports injuries. A CT scan is commonly used to diagnose a broken knee. It allows medical professionals to identify the location and severity of the fracture. Depending on the type and extent of the fracture, treatment options may vary. In some cases, non-surgical approaches like immobilization with a cast or brace, along with rest and physical therapy, may be sufficient for healing. However, for more complex fractures or when there is severe displacement of the bones, surgery may be necessary. During surgery, orthopedic surgeons realign the fractured bones and may use screws, plates, or rods to stabilize the knee joint. After treatment, rehabilitation is crucial for recovery. Physical therapy plays a vital role in strengthening the muscles around the knee, improving range of motion, and restoring function. Healing time for a broken knee can vary depending on the individual and the severity of the fracture. It's important to follow the advice and recommendations of your healthcare professional to ensure proper recovery. In summary, the broken knee is a challenging yet resilient condition that can significantly impact one's life. Through the wonders of modern medicine, we have seen remarkable treatments and rehabilitation techniques that aid in the healing process and restore function. Remember, early diagnosis and proper medical guidance are essential for optimal recovery.